Network. This is Medical Mondays.
Good evening, everyone. Thanks for finding us on News Channel 5 Plus and on Medical Monday. I'm Carrie Sharp. Great show for you tonight. Great topic that I know a lot of you all are dealing with at home. We're talking about foot health and how to have happy and healthy feet. I have a podiatrist joining us tonight. I want to welcome Dr. Matthew Neuhaus. Thank you for coming in.
Thanks for letting me be here.
You know, a lot of people have foot pain, have foot issues, and they're thinking, is podiatry the way to go? Do I need to go see the orthopedist or the podiatrist? And we were talking about this before the show. I want you to give me the rundown of all the things you all treat.
Well, there's a long list.
Yeah.
So the thing with feet is there's a lot of people that treat feet. Family practice doctors, chiropractors, orthopedists, internal medicine, physical therapists. There's a lot of people that think they treat feet, and they do treat feet. But podiatry is a specialty that we've gone to school for 4 years. It's a separate school. We're not MDs. We're doctors of podiatric medicine. So our schooling is a little bit different than a general MD doctor, your family doctor, or an orthopedist or anybody else, in the sense that our first 2 years are the same. We do basic sciences, anatomy, biochemistry, histology, all the sciences that any other doctor is expected to know. But when it comes to our rotations, our third and fourth years, we do general medicine, emergency room, surgery, we do all that stuff, but we focus in also on foot and ankle surgery, specifically biomechanics, which is how the foot functions, how we walk, and how the joints move. It's focused on what we do, kind of like a dentist goes to dental school and they're focused on the mouth. They're focused on the things that are important for that part of the body. And then we do a residency, and in our residency we do general training. I did neurology, I did an endocrinology, family practice, emergency room, anesthesia, orthopedics. I did everything in the hospital like any other doctor does.
Sure.
But then we hone in on the foot and ankle, and we spend 3 years in our residency doing just foot and ankle. Everything that's related to the foot and ankle.
And there's a good reason why this is a specialty. 25% of the bones in the body are located in the foot.
Yeah.
That's amazing.
Yeah, that's something a lot of people don't realize.
Yeah. I didn't know until you told me.
Yeah. So it's very intricate. There's so much that goes into the feet. Every step that we take, the joints move, those bones move, they rub together. If they're out of alignment at all, it affects everything. It'll cause knee pain, hip pain, back pain. A lot of times we'll use orthotics to help adjust the position of the foot, which affects everything. If we make the orthotic incorrectly, it can cause back pain, it can cause hip pain, it can cause knee problems. So podiatry is very unique in that we have to understand everything, it's not just a foot, it's a foot connected to the rest of the body.
Yeah.
Exactly.
On up. So if you have a question for Dr. Neuhaus, go ahead and give us a call. We'll get those questions lined up. The number is at the bottom of the screen. 615-737-PLUS is the number to call, or 7587. If I'm trying to read the screen, my eyes aren't that good. Maybe I need to go to the eye doctor too after this. All right, so give us a call. 615-737-PLUS is the number to call. We'll get those calls on the line, and we'll take just as many as we can tonight, as we always do. But again, let's talk about issues and ailments that you often see. Folks walking into your office, what are they coming in for?
So one of the most common things we see is heel pain or arch pain. And that's commonly known as plantar fasciitis for the majority of people. But what that is, the plantar fascia is a ligament that goes from the ball of the foot to the heel, and it holds our arch up. So every step you take, that moves. When you move the toes, it moves the plantar fascia. And people injure that from poor footwear, from standing on concrete at work, from running injuries. There's any number of different things that can cause an injury to the plantar fascia, and then the plantar fascia starts to swell, gets inflamed, and you just can't ever catch up, because literally every step you take, whether it's getting out of bed, going to the bathroom in the morning, or going grocery shopping, you're using the plantar fascia, and it just constantly pulls and becomes more and more swollen and irritated, and it's just vicious cycle.
It's highly painful. For anyone who has had it, they will explain excruciating pain.
Yeah, it's very painful, and that's probably 10 to 20% of any podiatrist practice. It's extremely common, and people will buy the Dr. Scholl's orthotics at the store. They'll buy these inserts. They'll change shoes. It's not uncommon for someone to bring in a bag of 5 or 10 pairs of shoes and say, which one should I wear? And I say, none of them. They're all bad. So shoes definitely play a big role in that.
Oh, I want to talk about that because I want the answer to that question. What shoes should we be wearing?
Oh, well, that's a very good question.
Okay.
You know, for most people, if you don't have foot problems, it probably doesn't matter what kind of shoe you wear. Most of us have a pretty biomechanically sound foot where the joints are lined up. We don't have any big deformities. We don't have bunions or hammer toes where our toes are curled, or we have big knots or things like that. In those cases, it probably doesn't really matter, and that's why Nike is so successful and Reebok and Adidas, because they don't make high quality shoes. They spend all their money on advertising, but most people don't need that added support.
Okay, so if you have bad feet, what should you be wearing?
Well, that's where it comes to a more supportive shoe, not something real flimsy and flexible. You want something more stable and solid. I always tell people you want a shoe that's going to bend where your foot bends. So if you're going to reach up into the cupboard, you're up on your toes, on the ball of your foot, that's where your foot bends, that's where your shoe should bend. But often if you look at your shoes and you see how they bend, they're super flexible and flimsy. They just bend every which way. So you're not getting any support. So if you have something like a plantar fasciitis, you have a tendinitis, you need better support to stabilize those ligaments and tendons, and most shoes don't do that for you. I actually went to a meeting. It was actually a course that I took on shoe design, and it was in New York City, and all the big shoe companies send their designers to this course. And I wanted to go because I wanted to understand the construction of shoes and how it all works. And literally the first day I asked this guy, who's this Italian guy from this Italian school that has designed shoes his whole life, I said, so how does fashion work with the functional shoe that is good for your foot? And he said, we really don't care. He said
it doesn't surprise me.
It's the holy grail of footwear, is what he told me. That the two are on opposite ends of the spectrum, and it's never gonna come together, so don't even try. So some of these designers that went to design school for footwear said they never took an anatomy class. They didn't understand the function of the foot. They couldn't tell you the name of one bone. They don't learn that when they're designing shoes. So we can't expect shoes to be high quality and serve the purpose that we think they're there for. They're really there just as a decoration.
Oh, were you disheartened by that when you heard that?
A little bit, yeah.
I'm sure.
Yeah, it was surprising to me.
Have you found that these shoes that some of the names are like cushiony feel or whatever, it's just to do that for you? Are they getting the job done?
No. So, in fact, these designers told me that memory foam is like their favorite thing to use. They use foam because they know that when they put foam inside the shoe, it feels good when you're in the store, and they know that it's going to compress, and in 5 to 7 days of wearing them, it's going to be flattened out and worthless. And they don't care. They know that then you're going to go buy more shoes.
Wow. So are orthotics the answer?
In many cases, yes. An orthotic that's well made, that fits your foot appropriately, can make a bad shoe into a good shoe.
So can you explain the process of making an orthotic? What goes into that when someone comes in and you say, okay, this is what I think will be the answer to your pain? What happens then? Yeah,
so when somebody needs more support for whatever the condition is, we'll recommend an orthotic. And there's different types of orthotics. You can get an over-the-counter orthotic, which is something you go to the drugstore and purchase, or you can have a custom-made orthotic. And there's a tremendous difference. Yeah. And there's a tremendous difference between the different over-the-counter orthotics. So I always tell people, and I don't need to badmouth Dr. Scholl's, but I don't want to. But I do badmouth Dr. Scholl's on a regular basis.
Well, you're the expert, so just tell us, lay it out there.
Because the orthotics you get from a drugstore or a grocery store pharmacy are really cushiony and rubbery, and they feel good when you put it on. It's kind of that same idea of the memory foam. It's going to feel good for a while, but it's not giving you any support. So an orthotic is a device that gives your foot support. So it needs to be more rigid. It needs to have a little bit of softness to it, a little bit of cushion so that it's comfortable, but it actually needs to be really rigid and solid. And there's very few companies that make devices like that. So I'll send them to some of the specialty running stores in Nashville to get a device like that that's over the counter. It should cost no more than $40. Okay. But it's not going to cost $5 off the shelf either. That you're wasting your money if you're doing that. So those are the over-the-counter orthotics. Okay. The custom orthotics is where we take a mold of your foot. We actually cast it. There's different techniques. They all work about the same. You can take a foam box impression. You can do a digital impression
Kind
where
of
you
a
stand
mapping,
on a
yeah.
little map thing and it measures it. You can do a plaster cast. I've used all the different techniques over the years. Depending on which laboratory you use, you'll use a different technique. But the idea is the same. You're supposed to line the foot up, make a device that is custom fit for that person, where the shape of the arch, the height of the arch, the width of the device will fit that person's foot. And it works really well when it's made the correct way. And any podiatrist is trained very, very well at making an orthotic.
What should the price point be?
Well, that's a good question. It used to be that all insurances would cover orthotics, so it didn't matter. Now, with the changes in healthcare, orthotics, and we call them durable medical equipment, braces, orthotics, things like that you apply to your body are typically, they have a separate deductible, and they're not covered by insurance now. So it depends on your insurance as to what the price is, because the insurance company will set the price based on the code that the doctor uses for what that is going to be paid. So there's a separate deductible. So it really depends on the insurance policy. It's anywhere from $250 to $600 in some cases, and cash prices are about the same.
Yeah.
So there's not an easy answer for that.
No, I understand. Okay, we're going to take a quick call before we have to go to break. Mike is on the line. Mike, thanks for calling in. You're our first caller tonight. What's your question?
Hey, I've got a question to the guy that's on your show tonight.
Good.
Like, they tell me I have cysts that pop up on my feet, and they have to cut on the bottom of my feet, and they said they would never come back, and they just keep coming back. Like, I had on my left foot, they had to take 3 centimeters off my foot, and now I've got more knots coming back. And on my other foot, Dr. Summers up in Nashville cut me to the bone, cut me all my tendons out, said they'd never come back. And I just keep having trouble with my feet. And I would like to ask the gentleman also, if you don't mind, do you guys ever have like a health clinic for like the homeless? Through my church, we work with the homeless in Nashville, and I see a lot of their feet messed up, like swollen up and this and that, and just want to know if there would be any way they could get in, you guys can help them in any way.
Okay, great questions, Mike. Thank you for calling in. I'll put you on hold so you can listen to your TV for the answer. Let's start with sound like a cyst issue.
Yeah, so what it sounds like to me that he has is what we call a IPK, or an intractable plantar keratosis, which people get these little hard knots. They're really hard calluses that will form on the bottom of the foot. They can be very difficult to treat, and frequently we will shave them down, put medicine on it. Sometimes I'll use an acid. Sometimes we do cut it all the way out. It sounds like what he described was somebody cutting it out and stitching it up. Sometimes they go away with that, sometimes they don't. It's actually a very difficult problem, and without evaluating it, it's hard for me to know if that's exactly what he has, but that's what it sounds like, is an intractable plantar keratosis.
Is it common for them to come back?
Yes, it's very common. It's a difficult problem to treat.
So he was under the assumption that they would not come back, but you're saying that's not the case.
Yeah, some people will try to promise you that things will be fixed forever. The reality is, with feet, oftentimes some of these conditions will recur.
What causes them?
That's a good question.
I'm full of good questions tonight.
There's some different theories on that.
Okay.
Some people believe it's a clogged sweat pore. We have lots of different sweat glands in the feet, and they can get clogged, and they get these hard keratin buildup inside it. Sometimes it's just a callus that just grows and grows and grows. It can be caused from stepping on something and having that object force the skin up, and it kind of the skin grows inward rather than out towards the bottom. There's lots of different causes for it, but each person's a little bit different.
Sure, I understand. Okay, his second question, homeless folks, and I have seen this myself, obviously they have a lot of foot trouble. Do you know of any clinics around here that help the homeless?
I don't know of any foot clinics in Nashville.
Okay.
Maybe that's something that needs to be done.
Yeah, it sounds like it. All right, we're going to take a quick break. Mike, thank you for your call and your questions. If you have calls that you would like our podiatrist to answer, now is the time to call. We'll get you lined up, 615-737-PLUS. That's the number. We're going to take a quick break, and we're coming right back.
Hey, Blair Durham.
Hey, how you doing, Mr. Blair Durham?
Hey, how are you?
Pretty good, pretty good. Man, I should have called y'all when I had my little accident.
Well, you know, Dad and I have lived in Tennessee all our lives.
Yes.
We'll take care of you and your family.
Do you have allergy symptoms? Dust a lot? Have black lines at the edge of your carpet? New home construction? Visit MrBAirDuct.com for a free estimate.
It's only one way, and that's the right way, and that's the way we do it at Mr. B's Air Duct Cleaning.
Staying healthy is on everyone's mind. Dr. Sean Pruitt has spent his career in medicine,
Do you have any questions?
dispensing expert advice and helping patients get on the road to recovery. Now Dr. Pruitt is here to help you. Introducing Pharmacist on Call on News Channel 5+. Don't miss your chance to get free advice. Watch Pharmacist on Call with Dr. Sean Pruitt the second Thursday of every month at 7 p.m. on News Channel 5+.
The family vacation. The ones you don't just remember, but replay over and over again. When your heart skipped a beat, soul filled with melody, and eyes open to the wonders of the world. A trip that not only defines a summer, but defines a family. It's a reunion that can only be made in Tennessee. Start planning at tnvacation.com.
Well, Thomas, you've got pre-diabetes. But with more exercise and a change in diet, it can be reversed.
I've tried exercising. It just makes me hungry for bacon.
I love bacon, too. And who really likes to exercise?
Not me.
Me neither.
Nobody. So we're good?
What? Oh, you still have pre-diabetes. Big time.
Why are you taking out life insurance policies on your clients?
How are we supposed to know which numbers to believe?
This has gone on for years. When do you go to the Attorney General and say, let's shut this place down?
If there's a perfectly logical explanation, why won't you give it to us?
That wasn't really accurate, was it? It's cheating the children.
You just don't see anything wrong with that. It seems like a nice kind of perk for the mayor.
Why did you take all the money from all those elderly people?
We're happy to call. We've made calls. No one's returning our call.
And why won't they fix it?
Is there anything you want to say, sir?
Continuing to follow breaking news.
Breaking news that matters to you.
Traffic is backed up.
Can come from anywhere.
Protesters have been
at any time.
Showers expected.
See it as it happens.
Rolled over school bus.
Live streaming of News Channel 5 is sponsored by Universal Kia.
Armand.
Hey, Bart.
Does he look better than he did a couple of months ago?
Way better. Sure.
Any of you ever in an accident, I hope you'll call me. Would you second that?
I will second that, Bart, definitely.
Welcome to Medical Monday. We are talking with Dr. Matthew Neuhaus today, a podiatrist, and we're taking your calls as always. 615-737+ is the number to call. We have Willie on the line. Willie, thanks for calling in. What's your question?
My question is, I have like, I don't know how to explain it, but it's like when I put on my shoes, it feels like grit or something extra in my shoes. It's kind of like my feet are kind of, my toes and stuff kind of don't help feeling it. But sometimes my feet feel cold. I can't explain it. But it feels like trash or something extra in my shoes when I put them on.
Okay. Does that make sense to you, Dr. Neuhaus?
Maybe.
Okay.
Yeah. One of the things that can happen to people that have diabetes is they can get what's called neuropathy, which is an abnormality in the nerves. So they won't feel things normally. It'll feel like he described, like sandpaper. They feel like they're walking on something that's not normal. And that's just abnormal nerve function where the nerves are damaged because of the high blood sugar over a long period of time. Sometimes it can be circulation, poor blood flow. The caller said that they have cold feet also, which can be related to poor circulation, which can also cause foot pain.
So what would you do in that instance? If Willie came into your office, what would be the next step?
If Willie had diabetes, had poor circulation, had feet that I was concerned about in that way, the first thing I would do would be do a circulation test to assess the level of blood flow. I would do some specific nerve testing to identify if indeed they have what's called neuropathy, which you can do with a couple quick tests in the office and just questioning.
Is there anything that can help?
Yeah, there's a lot of things that can help with neuropathy. The biggest thing for everybody is having a blood sugar that's under control. I find most diabetics that come to my office with these symptoms, their blood sugar runs 200 or higher, and they don't realize that high blood sugar is causing this kind of damage. So just lowering the blood sugar to a normal level is the first thing that every diabetic needs to do. But then there are different medications. There's some creams, and there's different things that we can do also that will will help with the painful neuropathy.
The damage that is done, and can it be reversible?
If it's to the point where it's truly numb and the nerves are damaged, then I find that it is not reversible, even though there's people out there that will make claims that it can be reversed. But if it's just a tingling, a burning, abnormal sensations, oftentimes that can be reversed with the blood sugar coming down and some different medications.
Okay, interesting. Willie, by the way, keep a pen and paper handy, and really for all of our viewers tonight, we're going to give Dr. Neuhaus's information out here at the end of the show, so you can make an appointment if you're interested. You have 8 different locations, right?
We do.
Yeah, all over Nashville.
Yes.
Stretching from where to where?
We go to Waverly, and then we go out to Lebanon, and we have offices in Mount Juliet, Hermitage, downtown at Midtown, and then in Smyrna and Brentwood.
Okay, so you're really spread out. All right.
And I forgot Bellevue. Can't forget Bellevue.
Don't forget Bellevue.
We're out there too.
Okay, very good. We have Dale on the line as well. Dale, thank you for calling in.
Yes.
Go ahead.
I have a question. I have my big toe nails, I had them cut off about 1.5 years ago, and they grew back but they grew back hard again. And I want to know, what can I do to soften them up, or do I need to have them taken off again?
Why'd you have them taken off in the first place?
Because they were hard. They grew real hard.
Okay. Can you help, Dr. Neuhaus?
So it depends on what the nails look like now. If the nails are damaged, if they've been taken off a couple of times, oftentimes the root of the nail is damaged, and that's what causes the nails to grow thick and be hard. So at that point, there's not a lot you can do to soften them up. You can permanently remove the nail so you just don't have one, which will eliminate the pain. But as far as removing it, letting it grow back, and thinking it's going to grow back normal, it's not going to happen in most cases.
So really the option is to take that nail bed out, right?
Yes.
Okay. All right. Hope that helps, Dale. We also have Ken on the line. Hi, Ken. Ken, are you with me?
This is Judy.
Oh, well, hi, Judy. I'm sorry about that. Go ahead with your question.
I'd like to ask the doctor, please, explain how bunions develop.
Wow, you want the short answer or the long answer?
Well, we do have an hour, so you take your pick.
So bunions, for the most part, are hereditary. So a bunion is going to develop because grandma had a bunion, and your aunt had a bunion, and your mom had a bunion, and then you're going to have a bunion. Bunions are an alignment issue with the way that the big toe moves, the way that your foot rolls in. People that have a flat foot tend to be more likely to develop a bunion, and that has, again, to do with the biomechanics, just the way everything moves together. Like we said before, the foot has 25% of the bones in the body. It's very complex, and when the big toe joint is stressed, it weakens the ligaments, and then that toe moves in a certain direction. Shoes can sometimes contribute to the formation of a bunion. If you're wearing shoes that don't fit, women that wear high heels over a long period of time, that can contribute to it. But the biggest issue with bunions is genetics.
All right, thank you.
You're welcome. So if you know you've had, your mom and your grandmother have had bunions, and you're on the, you're in your 20s or whatever, and you haven't developed one yet, is there anything you can do?
No.
Oh.
No. But if you're at that point and you haven't seen any signs of it, you're probably not going to develop a bunion. Most people will start to notice it in their 20s, 30s, and if you haven't, then you're probably safe. You probably got dad's genetics.
You can thank dad at that point. All right, but what do you do if you have one? There's a lot of different treatments, right?
Yep. So orthotics can help, again, to disperse the weight, take the pressure off the big toe joint, kind of rebalance things out. So a custom orthotic can be very helpful. Wearing shoes that fit appropriately, and this is where shoes are important. If you have a foot deformity of any sort, and I would classify a bunion as a foot deformity, having a good shoe makes a big difference to slow down that potential growth. If you have a job where you're on your feet all the time, you're wearing shoes that are tight in steel-toed boots on concrete, that can potentially make your bunion worse compared to the lady that does the news and is
and can
not
sit
on her
most
feet.
of the time.
Yeah,
Right. What about surgeries?
For bunions?
Yeah.
So bunion surgery can be very effective because we restore the normal alignment of the big toe joint, straighten the toe out, and then the joint moves normally. Sometimes people do need an orthotic afterwards, again, to rebalance the biomechanical issues that contribute to it if you have a flatter foot or some tendon issues. But surgery is very effective for bunions, and it's easier to fix a bunion when it's smaller than when it gets really large. Now, people I always tell people too, don't worry about your bunion if it's not painful. If it never bothers you, then I typically won't do surgery on it. I'll tell you to wear good shoes. We might try orthotics, that kind of thing. But once you start having pain, then, you know, depending on how it affects your life, that's when you start considering to have surgery or not.
And are you in a boot for a while? What happens?
It depends on the type of procedure you have. Most people can get away with a boot after surgery if you have a mild to moderate bunion. Once you have a really large bunion, that typically requires a bigger procedure, more bony work, and it's just more involved. So we do keep people off their foot if they have a really large bunion for at least a period of time.
Okay, good to know. We got to take another quick break. I see some more calls on the line. When we come back, we'll take those. We're also going to talk about hammer toes. So stick around for that.
This is a Storm 5 HD weather update. Sign up for Weather Call at newschannel5.com.
I'm Storm 5 meteorologist Leland Statham for today. Clouds from Irma continue to thicken as the rain from that system begins to move in this afternoon and especially tonight. Now, the southern counties, you're on a higher rain chance this afternoon than northern Middle Tennessee. Then the rain chances go up for all of us tonight. The extra cloud cover will keep temperatures down. We hit 80 yesterday. Today, only around the 70-degree mark. Check out what's happening now in Nashville. Also, the winds will continue to increase this afternoon, at times gusting up to about 35 miles per hour. Tonight, those winds gust up to 50 miles per hour, and that's the reason a wind advisory starts at 4 o'clock today until 7 a.m. tomorrow. So this afternoon, area showers developing, and then rain chances for a few days back to near 80 by Saturday.
A little help.
Jump, jump, jump. Bam.
35, 36.
Piffin and Ben premieres September 18th at 9 a.m. on News Channel 5.
That is a pretty good breakfast. You're not even eating.
Not hungry.
No? Why not? What's up?
Kath and I knew that Jenny had been partying a bit. Found out she tried heroin.
Most people don't know what to say about drugs, but we do. Visit us at drugfree.org.
Welcome back to Medical Monday. We are talking about happy, healthy feet, and if you don't have them, then tonight is the night to go. Dr. Matthew Neuhaus is here, a pediatrist in the area with 8 different offices, 8 different locations. It's Neuhaus Foot and Ankle. If you're looking for them, you can go ahead and look them up. We're going to give you the number and how to get in contact with them and make an appointment here at the end of the show. So get a paper and pen handy. But as always, we want to get to your call. So Carl is on the line. Carl, thanks for calling in.
Hello.
Hello. Go ahead with your question.
My question is, I wear boots like kangaroo boots are real lightweight, and I noticed over a year or so my heels are wearing on the outside on both feet, and just wondering what that might be causing that.
Okay, I'm sure you see a lot of different how we walk. It matters.
It does matter, yeah. So he's talking about the shoe wearing on the outside of the heel, and that's actually a very common, normal way for the shoe to wear. When we walk, most people have what we call a heel strike. So you hit with your heel and then your foot rolls forward. You should hit with the outside of your heel and roll in and push off with your big toe. Oh. So the big toe is the big lifting point to give you propulsion and keep going. So it's very normal to wear it on the outside. That's in the outside or the middle is where we want to see it. If it's wearing on the inside, that's a bigger issue that can cause problems. I would also remind him though that if your shoe is worn like that, you need new shoes because that will cause a problem. The heel should not be worn. By the time the shoe has the rubber on the heel worn out, the rest of the shoe is shot, and you need new shoes.
So, Carl, it's time to go shoe shopping.
Yeah.
That sounds like fun to me. Good luck with that, Carl. Thank you for calling in tonight. Do you see many runners who come in and say, man, I'm not feeling good when I'm running, or what do you hear?
We see a lot of runners.
Yeah.
Yeah, we treat a lot of runners.
What are the common complaints?
Kind of the same as everybody. You know, they don't come in until it hurts.
Yeah.
And they've tried to treat it. Runners are the worst at trying to treat things. They talk to their other runner friend that had this problem and that problem. We see a lot of stress fractures with runners.
Really?
See a lot of people that are trying to get into running that will develop plantar fasciitis or tendonitis, Achilles tendonitis. Stress fractures are probably the biggest thing we see with runners. The newer runners don't understand how often they need to change shoes. You know, running shoes are very expensive, especially if you get a good pair. And all the good research says you should change your shoes between 300 and 500 miles. So it's really important to keep a log if you're a serious runner, to know how many miles are on the feet, on the shoes. And the reason for that is the shoes are typically made out of a substance called EVA, which is in the sole, which is a foam that's in the rubber, and that compresses. It has little air pockets, and as you pound and run, those air pockets compress, and then you lose the cushioning that's in the shoe, and you can't really see it. By the time you see the wrinkles in the rubber and the sole, and it's looking old, those air pockets are long since gone, and you've lost the cushioning in that shoe, and that's when you're going to develop a stress fracture or tendonitis, because that shoe's not giving you the support that you need to take that pounding that a runner's going to give it.
I just went through that with shin splints. I went, uh-oh, it's time.
Same thing.
It's beyond time.
We'll see the shin splint problem, and that's a big part of it, is once you feel that kind of coming on, first thing you should do is change your shoes.
Yeah. Okay. You also have a procedure that you do with a hammer toe. And before we get into the procedure, what is a hammer toe?
Yeah, so a hammer toe is just a curled toe. It's when your toe is bent, kind of like you bend your finger. Your toes will bend that way. They should be straight. When they have a little bit of a curl to them, that's a hammer toe. I'm not quite sure where we got the term hammer toe.
Yeah, because
maybe you hit it with a hammer to straighten it out. I don't know where it came from.
You know, they may have done that back in the day. I wouldn't be surprised. And it usually is not the big toe, it's the other toes.
It's the small toes, yes.
Okay, so what do you do? What's the most effective way to treat that?
Well, first thing you got to figure out what's causing the hammer toe and what kind of hammer toe it is. So there's flexible hammer toes, and then there's rigid hammer toes. A flexible hammer toe is one you can grab and you can straighten out. A rigid hammer toe is one where it's really arthritic and it's locked in that position, you can't move it. The rigid one, obviously, you've had longer than the flexible. So for a flexible hammer toe, frequently I've been, well, let me back up. So with hammer toes, you have to typically cut out the bone, rebalance the tendons, and straighten the toe. We use pins or implants in the toes to hold them straight. With a flexible hammer toe, sometimes you have some leeway as to what you can do. And I've been doing a procedure for the past several years that's what we call percutaneous, which means I do it in the office, I use a needle, and I actually go in and just rebalance the tendons. So I cut the tendon that's causing the deforming force that's causing the toe to bend down, which straightens the toe, allows the other tendons to come in and be stronger. So we have tendons on the bottom. Tendons connect muscle to bone. We have tendons on the bottom and on the top of the toes and the fingers. That's how we straighten and bend them. So typically it's the tendon on the bottom that's pulling too tightly, and you can make a tiny stick in the middle with a small needle and sever that tendon. It kind of frays, and it lengthens it, then it'll scar back in a lengthened position and the toe straight.
And it's minimally invasive. That's why part of this is so attractive, right?
Yeah, it's a great procedure because it's literally a needle stick, just like drawing blood. I put a Band-Aid on it, a little bit of a bandage if it bleeds, stick them into their regular shoe, and send them on their way and just tell them to take a few days of taking it easy, and it heals up wonderfully well.
Wow. So. Now you have a YouTube channel. There's a video of this on there?
Yeah, so we do have a YouTube channel. I've had it for years. We've got videos of different conditions, educating people on exactly what you're asking, what a hammer toe is, what different conditions are, and we put procedures on there. So a few years ago I put a procedure doing this flexor tenotomy is what it's called. It's straightening a hammer toe, and it's been wildly successful.
You said you had a lady come from Peru.
Yeah, we get people from all over the country, and we recently had a lady from Peru call us. She worked for the U.S. Embassy in Peru and was coming here for training, and said, hey, as long as I'm coming, let me get my toe fixed.
Yeah.
And we actually did toes on both feet. She did wonderfully well, and she's contacted us about having some other work done in the future when she comes back. So yeah, and that's because I do it in Spanish and English.
Right.
I speak both languages, so I put the videos in both languages, and we literally get calls and emails from all over the country and all over the world.
I'm sure. Okay, very good. How do we find that YouTube channel?
It's if you type in Neuhaus Foot and Ankle or just Neuhaus Foot Doctor, it'll come up. Yeah, it's pretty easy to find on YouTube.
Easy enough. Let's jump back to the lines. Ellie is on the line. Ellie, good evening. What's your question?
Hi there.
Hi.
I have knots in the arch of my feet, and it started out in one foot, and then a couple of years later it came in the other foot. So they're in both feet, and I was curious to maybe, I was told it was probably a torn muscle.
So I guess I'd ask, is it a hard knot or a soft knot?
It's hard.
Okay.
They're hard.
And is it right below the skin in the arch?
Yes.
Yeah. So that is most likely what we call a plantar fibroma. A plantar fibroma is scar tissue that forms within the plantar fascia. Again, the plantar fascia is the big ligament that connects the heel to the toes. And if you pull up on your big toe, you can put your finger on the arch and you'll feel this hard structure, a band of tissue that forms when you pull the big toe up. That's called the plantar fascia. And these little knots will form in that edge. It's the medial edge of the plantar fascia. And what that is, it's scar tissue. So at some point you had a tear in the plantar fascia and you had excessive scar tissue form. Now, the difficult thing with that problem is they're very difficult to treat. They frequently will not go away on their own, and they can recur if you surgically cut them out. So there's a healing problem with that ligament. It's a hard problem for us to treat. It really is.
Why is that ligament so problematic? Is it just because we use it with every single step?
Yep. It moves.
Well, I've been a runner, so I didn't know if I did it from running.
Probably, yeah, that's probably. But it can happen just walking. I mean, it's not necessarily a running injury. It happens to people of all ages and activity levels.
Okay, Ellie. Sorry, I wish we had better news for you. Is there anything you would suggest for her to do if it's?
Yeah, I mean, sometimes I'll give people cortisone injections. I'll use alcohol injections. We can do orthotics. There's some different prescription creams that we use. There definitely are things that we can do for it. In some cases, I will surgically remove them, and they don't always come back, but they have a high likelihood of coming back. You have to be really careful with them.
Okay.
You don't jump to surgery with that problem.
Gotcha. Ellie, thank you for your call. Good luck.
Thank you. Bye.
All right. We also have Cheryl on the line. Cheryl, good evening. What's your question?
I got a question about my toe. It's dark. It's dark. And I'm trying to find out what could be causing that.
It's darker than the rest of your toes? Is that what you're saying?
My big toe. My toenail. On my toenail.
It's the toenail. So color changes in the toenail can be lots of different things. It could be, if it's just dark and bruised looking purplish, that could just be a little bit of dry blood underneath the toenail that you stubbed your toe. And that takes a long time to clear out. You have to grow a new nail, which can take 6 to 12 months for that to clear up. It could be the start of toenail fungus, which is an infection in the nail and the nail bed, and that may never go away without treating it. That in those cases, the nail gets thick and not just discolored, but it'll thicken, and again, without treatment, that's not going to change.
Okay, so something that she should probably come in for just to take a look.
She would need to have that looked at to know what's causing it.
Okay. We also have Kay on the line. Hi, Kay. Good evening. What's your question?
Does Medicare still cover the inserts and the orthotic shoes if you are diabetic, and how much do they cost along with the Medicare?
Yeah, I'm glad you asked that question, because this has been an issue for us for years. So Medicare has what's called the therapeutic shoe program, and diabetic patients that qualify can get one pair of shoes and inserts per year, per calendar year, from January to December. What has happened with Medicare over the past 5 to 6 years is they've really become sticklers on auditing providers that supply shoes. And what they're looking for is, this program was abused for a long time, and they were spending lots and lots of money on shoes and inserts for people that didn't necessarily need it. The purpose of the program is to provide shoes for people that are at risk for an amputation or losing a part of the foot or a leg. And what happened was anybody that had diabetes was getting shoes. And that's the misconception, is people think they can get shoes because they have diabetes and they have Medicare. And that's simply not the case. There's a list that Medicare puts out that you have to meet the criteria before you qualify for shoes. And that is, you have to have poor circulation, you have to have a deformity, you have to have a callus or some sort of pre-ulcerative lesion, they call it. an amputation, and it may be a prior amputation. There's a very strict list, and if you don't meet that criteria, then you don't get the shoes. And Medicare started auditing doctors and the providers that would supply shoes. And now a lot of people just don't even supply them in the city. It's a hard
they don't
thing.
want to deal with it.
Yeah, Medicare's, they audit everything, and the paperwork has become very onerous. You need signatures from, everybody that has ever seen you, it seems like. Yeah. And it's just made it really difficult to even get the people that need the shoes, the shoes. So it's not that Medicare doesn't cover them anymore, but they're just really strict on making sure everybody is doing it the right way.
Do you accept Medicare?
We do.
Okay.
Yep.
Well, so it's good to know. So
How much are they if Medicare covers it?
Well, that's a good question. The Medicare will pay for the shoes, and if you have a secondary insurance, that will cover the rest of the cost. Medicare will pay for 80% of the cost of the shoes, and they have a set fee schedule that, honestly, it's been quite a while since we've done shoes in our office, so I don't remember. It's a couple $100. I think it's like $250, maybe even $300 for the shoes and inserts. But Medicare covers the majority of it, and if you have a secondary, they cover all of it.
Good deal.
If you have discoloration, if your feet have discoloration in the skin, and you've already been through felt like you were walking on great period.
Would that be one of the pre-existing or the qualifications? Is that what you're asking?
Yeah.
Okay.
No, actually that doesn't. If you have neuropathy, which is nerve damage, that doesn't necessarily mean you qualify for shoes. If you don't have a deformity, if you don't have a callus, if you don't have something that could lead to you losing a toe, you just have some numbness, that alone in and of itself does not qualify you for the shoes.
Okay. All right. Well, thank you.
Thank you for calling in. I feel like we got a lot of information out there. I appreciate that phone call. We have to take another quick break, but Sally Ann and Lisa, I know you're on the line. As soon as we come back, we'll take those calls. Stay with us.
This week on Fishin' Affliction TV.
Say something, big doggy. Say something.
Join the guys for part 1 of Getting Wet as they're doing some fishing on Lake Guntersville with Pat the Patriot Anderson.
Say something.
That's a nice 3-pounder, Dan.
Say something, big dog.
That's a nice 3-pounder.
Your Fishin' Affliction TV weekend begins Saturdays at 5 p.m. right here on News Channel 5 Plus, your home for
Fishin' Affliction.
Oh, beautiful for spacious skies, for amber waves of grain, for purple mountain majesty, above the fruited
Good morning. Hope you all had a good weekend and are ready to be inspired. One quick thing I want to remind you guys to be studying.
Major key alert. Did you just look at your phone while you was in class? You played yourself.
Class, today we're talking about inspirational quotes.
You want to get that paper? You better turn in that paper and get an A+. That's a major key. Another one. Another. Mogul talk. You want to reach the mountaintop? You got to go hard. To succeed, you have to believe. Stay focused. Fly higher than the eagle. Don't ever play yourself. The key is to make it, so make it.
Louise, can you give me an example of an inspirational quote from recent history?
Don't play yourself. The key is to make it.
And who said that?
I did. Now that's a major key alert.
Learn the real major keys to getting to college at getschool.com.
Welcome back to Medical Monday. We're talking about getting your feet to be healthy and happy and feel good. Dr. Matthew Neuhaus is in here from Neuhaus Foot and Ankle. Thank you for being here. We're getting lots of calls, and that tells me that a lot of people have foot trouble that they would like to get rid of. And we have 2 callers on the line I'd like to get to. Sally Ann is with us tonight. Hi, Sally Ann.
Hello.
Thank you for your patience. What's your question?
Well, I have a toenail on just one of my foot that has, it's like a hard rock, and it seems like it keeps getting bigger and bigger. My husband tries to file it down for me, and it's really, it hurts at times because it's so high up.
Okay.
And I don't understand what it is or why I even get that.
Yeah, good question. What do you think?
Well, you may have a fungus in there. That's the most likely cause, is toenail fungus. Sometimes people damage their toenail. If she's injured it over the years, it'll just grow up rather than out.
Right, that's what it's doing, is growing up rather than out.
Yeah, so it's probably damage to the root of the nail. And you can go in, and any podiatrist can file that down for you and get it comfortable, or you can have it removed if you've got good blood flow to that toe, where you just don't ever have to worry about it doing that ever again. You can have it permanently fixed.
Oh, so she should have it probably maybe permanently removed?
I would go get it looked at, and that's an option.
Okay.
You can have it trimmed down every once in a while, once a year. I mean, they're not going to grow fast.
Okay.
Yeah, well, I don't know if I want to have it pulled off, because that's probably going to be very painful.
It's not as painful as you think. It really isn't. It's all that nail that's growing up is dead tissue. So you can clip that away, and it just feels better. And you know, if you permanently remove it, that doesn't hurt to have it removed. It'll just keep it from coming back. But those are the options: either have it trimmed down or have it permanently fixed.
So you think it was caused by a fungus, though?
Well, it's either a fungus or trauma. Those are the 2 things that will cause something like that.
Okay.
Well, Sally Ann, we're going to give you the name and number here at the end of the show, so get your pen and paper ready.
Okay.
And maybe you can get this fixed once and for all. But you have a good husband for filing that down. Isn't that nice?
Yeah,
That's a good husband.
I do.
Thank you for your call. I appreciate it. Okay, let's talk to Lisa. She's on the line waiting ever so patiently. Hi, Lisa.
Hi.
Go ahead.
I have a question. Like, my grandmama's toenails are brown, and then they grow so long, and then they'll curl over, like under her big toe. And then when you try to clean it, it hurts because it's got, like, I guess it must be dead skin or something.
Okay. Any tips?
That sounds like the same type of thing. That's most likely a toenail fungus that's causing that. So I'd say get in and see your doctor, come to our office, see us, see a podiatrist that can assess that and tell you if it is indeed a fungus, and get you some treatment for that.
Okay, thank you, Lisa. Good luck with that. Ron is also on the line for us tonight. Ron, what's your question?
I was wondering what causes spurs in your feet. I broke my leg a long time ago, and I was trying to figure out, is that what caused a spur in your feet, like a corn on the bottom of your feet, because river is sore and tender?
Yeah, so bone spurs are caused from abnormal pressure. Something is pulling on the bone, causing it to form a bone spur. Bone spurs in and of themselves typically don't cause pain. What causes pain is the soft tissue that's attached to the bone there that's pulling, that's tight. So a lot of people will see have heel spurs, but we can make that pain go away without doing anything to the bone spur. Now when you get a corn on your toe, which is a hard callus, hard tissue, sometimes that is caused from a bone spur that needs to be removed, and that's the only way to fix that. Trauma can do it. He said he had a leg injury. If you have a fracture, sometimes the bone overheals and will grow extra bone, and you'll get a spur that way. But typically what we see when people talk about spurs, it's heel spurs on the bottom of the foot that is caused from a tight plantar fascia and tight musculature on the bottom of the foot. Sometimes it's a tendon that pulls on the bone, and the bone just grows up into that structure.
Okay, Ron. So your tip for Ron, what should he do?
I'd probably go get it checked out, because it's not as simple as a heel spur. Get an X-ray and get an evaluation, and most people have that pain go away. If that's pain in the bottom of your foot in the morning when you get out of bed, go from sitting to standing, that pain can go away. We can fix that pretty easy.
Well, that's good news. All right, Ron, good luck with that. Thank you for your call tonight. Hopefully that helps you just a bit. I do want to talk about ingrown toenails. I imagine this is a pretty common ailment. What causes them? What can you do?
Yeah, ingrown toenails are very common. Sometimes it's just cutting the toenail wrong. Sometimes it's genetics of having a wide toe. A lot of things can lead to ingrown toenails. But what people don't realize is ingrown toenails can be fixed forever. A lot of people just do their bathroom surgery once a week. They go to the bathroom and get the clippers out and just fight through it and cut it way back. That doesn't need to be done. There's a simple procedure we do in the office. We numb the toe up, cut just a sliver of nail on the edge, and take out that piece that's down underneath the skin, put a little chemical on it, and fix it forever. And it doesn't ever come back. It grows a nice straight edge. Again, on my YouTube channel, that was the very first video I ever did. And I go through it step by step. I show you exactly how to do it. If you want to try it at home, if you have the right instruments, you could do it watching my video.
No.
But really, it's a great procedure, and most people don't realize how easy it is to fix them. And it's not super painful. We don't give pain medicine after you have the procedure. People just feel better when it's fixed, and knowing that it doesn't ever have to come back. It's very rare. I call it my 98% procedure. It's very rare that I have anybody with problems or a regrowth of the nail.
Gotcha. Okay, so many people get pedicures these days. So many people. You have any pet peeves when it comes to what's happening there?
Well, the thing I always tell people with pedicures is make sure they clean their instruments appropriately. Some of these places will soak their instruments in this liquid, and they're super busy. There's a certain time period the instrument has to be in there before it's clean. And if they're really busy, they're not cleaning the tubs right, they're not using the instruments that are clean, they're treating people that have a nail fungus or an athlete's foot, and they can spread those diseases. Sometimes they'll cause an ingrown toenail by scraping or cutting too deeply. You know, there's a lot of issues that we see from pedicures, believe it or not.
Oh, I believe it. Yeah. Okay, so be careful where you choose to go, I guess, is what you're saying.
Yep. In fact, a few years ago, we started a nail spa in our office.
Oh, that's a good idea.
So we have a lady that works there. She has 2 chairs, 2 manicure tables, 2 pedicure chairs. We've got a couple ladies that work there, and they are trained what to look for. They clean their instruments with our autoclave, which is the hospital sterilization method. So they use clean instruments for every patient, and they do a really good job at making sure that people don't have problems. And if they do have a concern, we're across the hall, so they send them right over and we talk about it.
That was a genius idea. All right, before we have to go, I want to get in Ray real quick. Ray, we're kind of against the time clock, so if you can answer your question quickly, that'd be great. Ray, are you with me?
Yes.
Okay, go ahead.
Okay. To describe my wife's problem, like I said, she has very thin padding under her, on the bottom of both feet. She has what they call a spur or a seed within her feet, and she'll try to pick it out. But like I said, the doctor said that they could try breaking her feet to reset her bones, but that doesn't solve the problem of her having the thin sole or thin skin on both of her feet, which is really what the doctor says that they really cannot resolve.
Does this make sense to you?
It does, yeah. Some people will lose the fat pad. They get what's called fat pad atrophy. We should all have a certain amount of fat on the ball of the foot and on the heel. And as we age, some people will lose that fat, and they will be walking on bones. People that have rheumatoid arthritis will develop this condition where they just literally walk on the bones, and it really hurts. So sometimes we actually do surgery to adjust the bone or remove the part of the bone. And it's hard to say exactly what's going on here without an x-ray and seeing the patient, but losing the fat on the ball of the foot certainly does happen.
Okay. Gosh, I hate to hear that, Ray. Thank you for calling in. Again, everyone grab your pen and paper. When we come back, we're going to be giving you the email address and also a number to make an appointment. So stay with us. We're coming right back.
This is a Storm 5 HD weather update. Sign up for Weather Call at newschannel5.com.
I'm Storm 5 meteorologist Leland Statham for today. Clouds from Irma continue to thicken as the rain from that system begins to move in this afternoon and especially tonight. Now, the southern counties, you're on a higher rain chance this afternoon than northern Middle Tennessee. Then the rain chances go up for all of us tonight. The extra cloud cover will keep temperatures down. We hit 80 yesterday. Today, only around the 70-degree mark. Check out what's happening now in Nashville. Also, the winds will continue to increase this afternoon, at times gusting up to about 35 miles per hour. Tonight, those winds gust up to 50 miles per hour, and that's the reason a wind advisory starts at 4 o'clock today until 7 a.m. tomorrow. So this afternoon, area showers developing, and then rain chances for a few days, back to near 80 by Saturday.
We're here. We're American. We're going to take you home.
Guys, you want to go out into the city on foot?
Seriously? It's still kind of Mad Max out there. Let's do this.
Make it back home to us. Be safe all when you can.
Fire to home! You can run, but you can't hide.
Sometimes feel you're only halfway ready for the morning? Running at half speed? With half the time and half the energy.
Good
News Channel 5 this morning makes you feel whole.
Breaking news.
Armed with information. The breaking news you missed. Your day planner forecast.
Great way to start the day.
And the only bird's eye view of traffic with Sky 5.
Follow several stories.
Get the news you need to take on the whole day. Watch tomorrow starting at 4 a.m.
Thank you so much for your calls tonight. A lot of questions answered. Appreciate all those answers and the knowledge you've given out over the last hour. You have a new website that goes live tomorrow. What is it?
We do. It's neufoot.com.
Now you need to spell that.
Yeah, it's N-E-U, like my last name is N-E-U, foot, F-O-O-T.
Okay,
Neufoot.com.
So neufoot.com. Also, how can people get a hold of you?
They can call us. 615-220-8788 is our main number. We use that for all the offices.
And you do have 8 different locations. It's called Neuhaus Foot and Ankle.
Yep.
Now, I also want to give you the Advanced Health number and email address. It is on the screen right now. I'll say the phone number for you, 615-986-6033. That's 986-6033. You can call that number, say, I want to talk to the podiatrist. They're going to get you to Dr. Neuhaus. That's the easiest way to do it. So hopefully you can get some problems solved. Thanks for being here, Dr. Neuhaus. Appreciate it.
Thanks for having me.
No problem. Everyone, have a great night.